Hello and welcome to the Happy Artichoke. My name's Dr. Rachel. I'm a doctorate prepared nurse and I had my thyroid removed in 2020 due to Graves' disease. My channel is dedicated to sharing my knowledge as a patient and as a nurse. Today I'm focusing on nutrition, specifically after thyroid surgery. I do have a PDF on my website with 5 recipes for after surgery, and those are all high in vitamin C, zinc, and protein, which are very important for wound healing. These meals are designed to support recovery after surgery, especially when swallowing is difficult. The resource also incorporates other foods that are high in vitamin C, zinc, and protein, and identifies how much to aim for when you're healing from surgery. While I do have free resources like this video and like my thyroid surgery discussion guide, which is on my website, I have offered this PDF at a nominal price just to help support my website. Thank you for supporting me while I support you. I know that it can be really overwhelming after surgery, and my hope was that having a plan for meals for at least the first couple days after surgery would be a really helpful way to start your recovery. Plan in advance by making sure you have all of these grocery items in your house. Okay, let's talk about nutrition while you have thyroid disease and things that you can do to feel like your best self. So some of these things might feel obvious, but the truth is we can't ignore talking about general nutrition and having a well-balanced diet when we talk about people with thyroid disease. We're also going to talk about what the data says about lactose and gluten in thyroid disease, and then I'll share a little bit about my own experience with the elimination diet and an anti-inflammatory diet. Nutrition for those with thyroid disease is not really that different than nutrition for people without. There is some discussions about the role of iodine in thyroid disease, and so too much or too little iodine can cause some issues. Iodine is found in seafood, dairy products, and iodized salt, so that is something to be aware of. I'll just start with a very basic summary of lifestyle guidance and nutrition. I'm not a dietitian, but I have an interest in nutrition and have learned a lot about it over the years in nursing school, also while taking care of patients. And also I've had my own personal journey with nutrition while trying to put on muscle actually while I was in hyperthyroidism and didn't realize it. So I have learned a lot about micro and macronutrients along the way. So here's a summary of basic nutrition and lifestyle guidance. This incorporates general goals for a healthy diet, physical activity, hydration, and then limits on harmful substances. And this is all based on recommendations from the World Health Organization, the USDA, and the CDC. So I feel like we should just start with like general wellness tips, which are to prioritize your sleep, so 7 to 9 hours per night, limiting ultra-processed foods and fried food, reading nutrition labels to stay informed, and then practice mindful eating if you can. So eating slowly, enjoying your meals, listening to your own hunger and fullness cues, things like that. Then when it comes to things that we're trying to avoid or limit your added sugar, being mindful about how much salt you're putting on your food, limiting alcohol. So for women, that's up to 1 drink per day, and for men, up to 2 drinks per day. But overall, alcohol is not recommended for health benefits. And of course, if you're pregnant or have certain medical conditions or are taking certain medications, you want to avoid alcohol as well. Avoid tobacco entirely because we know this increases your risk of cancer, heart disease, stroke, lung problems. Then when it comes to exercise, strength training is so important for your balance, for having strong, healthy bones and muscles as you get older. I can't tell you as a nurse how many people I take care of in the hospital maybe wouldn't have had to be there if they had done strength training and had more balance. The amount of people who are between the ages 55 and 70 who have fallen and broken things, broken bones, had head injuries. This could have been prevented with exercise. So please, please, please do your strength training. That wasn't in my notes. I didn't know I was going to talk about that. But I've been on the trauma unit for a while now, and I just want everyone to go to the gym and take care of their body so you don't end up in the hospital when you're older with broken bones because you don't have balance. Okay, I'm done with that tangent. Let's move on. It's recommended to do some sort of muscle strengthening at least 2 days a week. This could be weightlifting, this could be yoga, body weight, this could just be push-ups at home and 100 squats, or whatever it is. And then for aerobic exercise, this is at least 150 minutes a week of moderate intensity, or half of that with vigorous intensity activity. So walking, swimming, cycling, biking, whatever it is that you like to do. Then we should talk about water intake. The goal for women is about 11 cups of water a day, and for men it's 15. So grab your water bottle, fill it up. Water should be your primary source of hydration, although when it comes to post-thyroid surgery, you might include things like popsicles, broth, jello, things like that. Okay, so let's just talk about like basic nutrition. So this is your fruit and vegetables, your dairy, your protein, your grains, healthy fats. Let's just do a basic quick run through of those things. Fruits and vegetables, you want at least 5 servings a day, 2 cups fruit, 2.5 cups vegetables, something like that. You want to eat a variety of colors to get a variety of nutrients. This is also going to give you fiber, and it's going to also help hydrate you. Protein, like lean meats, poultry, fish, tofu, beans, eggs, seeds. We want about 5 to 6 ounces a day for most adults, and it's a good idea to aim for some plant-based protein sources weekly. When it comes to your grains, you want at least half of them to be whole grains, if not all of them. Brown rice, quinoa, oats, whole wheat bread, about 6 servings a day is what's recommended. And then dairy or a 4 to 5 alternatives, milk, yogurt, cheeses, 3 cups a day. And then when it comes to fats, you want to just focus on healthy fats. So avocado, olive oil, nuts, things like that, rather than your saturated fats, which are found in animal products. And then you want to avoid trans fats entirely when possible. That's things that are like highly processed, like donuts, prepackaged bakery items, things like that. So that's kind of like a basic overall nutrition guideline. Now, there is no evidence for lactose-free or gluten-free diets in thyroid disease, but if you find that these diets personally make you feel better, then I say go for it. I had an experience that I wasn't expecting with the elimination diet, which you can do on your own. You don't need to necessarily do it with a dietitian or a licensed practitioner, although it's always helpful if you can. Essentially, it's removing things from your diet that could be inflammatory to your body. It could be common allergies as well. So shellfish, eggs, soy, corn. You're removing a lot of things. So you're really focusing on whole foods, really. So you're eating a lot of like vegetables, some grains, fish, meat. The way that it works is you slowly add those things in like 3 weeks at a time. So you go 3 weeks with removing everything and then you add in one thing. So it's quite a time commitment. It took me more than 6 months to add things in slowly. And I found that I had foods that just did not work well with my body. And when I eliminated them, I felt incredible. I also found it very frustrating because I had to eliminate a lot of things from my diet that I really enjoyed eating. I found that I had digestive problems with dairy and shrimp and soy. And I also found out that when I had gluten, I had really bad joint pain. And so when we're dealing with an autoimmune disease, most of us have with thyroid disease, it can be really helpful to figure out if there's things that are causing inflammation in your body. So for me, eliminating soy, gluten, shrimp, and dairy I was able to get away with sometimes. Eliminating those things from my body reduced so much of my problems, my joint pain. I wonder if I had figured this out sooner in my life, if maybe I wouldn't have had to remove my thyroid. I don't know for sure, and I'll never know. But I do know that when I eliminate those things from my body now, I feel so much better. Now, I also lived in Europe for a couple years, and I was able to eat a lot of those things without problems. So I think part of it is the way that we process it in the United States, as well as the amount of pesticides we use and things like that, which could be an entirely different conversation. It's worthwhile to try an elimination diet if you are motivated. It has definitely highly impacted my life, and I think it's a great investment to your health. Really good idea to just try it out. And you can just find that online. If you type in elimination diet, you'll be able to find some information about that. Now, when it comes to thyroid surgery and recovery, an important piece of recovery is nutrition. It's so important. This is not a time to try to lose weight. This is a time to love your body, give it good nutrition, give it good rest, good hydration. All of these things are really important after surgery. Check out the PDF I have if you'd like some meal ideas. Our body requires different amounts of some nutrients after surgery. So the macronutrient of protein, our body's going to need a lot more protein per kilogram after surgery, and I have that listed on the PDF. Vitamin C and zinc as well. We do need more after surgery than we do during like a normal day when we don't need as much immune support or wound healing. So I have those listed out in the PDF as well. So I hope this was helpful. I know it's kind of just a general overview, but I thought it was important for me to just talk a little bit about general nutrition as well as lifestyle, because I get a lot of comments and questions about that. And I thought it was really important to talk about the elimination diet. And if you are having surgery, please take care of yourself. Make sure you get your nutrients, make sure you hydrate, make sure you're getting enough protein. It's so important after surgery to do all of those things, especially when you're not moving around as much. Staying hydrated is going to help your digestive system. If you're on pain medications, those can constipate you, so making sure you're hydrated. I hope that this helped. Again, if you'd like to check out any free resources, you can continue looking around on YouTube and on my website. happyartichoke.com/resources has a free downloadable talking guide for if you're planning on having thyroid surgery. And also you can purchase the PDF with some recipes to support healing and nutrition after surgery. Thank you. Take care. I hope you have a great day. Bye.